FibroTest, known as FibroSure in the U.S., is a biomarker test that uses the results of 6 blood serum tests to generate a score that is correlated with the degree of liver damage in people with a variety of liver diseases. FibroTest has the same prognostic value as a liver biopsy. FibroSure uses quantitative results of 5 serum biochemical markers:
Alpha 2,
macroglobulin, haptoglobin, apolipoprotein A1, bilirubin, gamma-glutamyltranspeptidase, GGT, with the patient's age and gender to generate a measure of fibrosis and necroinflammatory activity in the liver. FibroTest medical diagnostics purpose: assess degree of liver damage. FibroTest has been evaluated in relation to liver biopsy, the current reference standard in liver disease assessment in people with hepatitis C, hepatitis B, and alcoholic liver disease. Non-alcoholic fatty liver disease. They are most useful for cirrhosis and less useful for other stages of liver disease. By 2008 it had been used in over 350,000 patients. In 2006, the French National Authority for Health recommended the use of FibroTest as one of a number of first-line assessment tools for fibrosis with untreated chronic hepatitis C. Contents procedure. The FibroTest score is calculated from the results of a 6-parameter blood test, combining 6 serum markers with the age and gender of the patient: alpha, macroglobulin, haptoglobin, apolipoprotein A1, gamma-glutamyltranspeptidase, GGT, total bilirubin, and alanine transaminase, ALT. ALT is used in a second assessment called ACTI test that is part of FibroTest. The equation for calculating the FibroTest score regression coefficient, logistic regression, is Z equals 4.467 multiplication log 1.9 GL 1.357 multiplication log 0.652 GL plus 1.017 multiplication log IUL plus 0.0281 multiplication plus 1.737 multiplication log 18.126
micromi,
MOLL 1.184 multiplication 1.45 GL plus 0.301 multiplication 5.54. Due to variability of components, assays and analyzers, FibroTest assays can only be performed in validated laboratories. FibroTest cannot be used without algorithms that detects false positives and false negatives. The equation alone is not a diagnosis tool. The laboratory or physician connects to the biopredictive website for calculation of the test results and prints a results sheet, which is available immediately and is accompanied by an interpretation aid and precautions for use. Applicability. Over 95% of tests are interpretable and allow diagnosis of fibrosis and liver activity. In less than % of cases, likely false positives or false negatives are highlighted. FibroTest has been validated for chronic hepatitis C, chronic hepatitis B, chronic hepatitis C or B with HIV co-infection, alcoholic liver diseases, steatosis and steatohepatitis, and non-alcoholic steatohepatitis, diabetes, overweight, hypertriglyceridemia, hypercholesterolemia, hypertension. FibroTest is independent of ethnic origin, sex, genotype, viral load, transaminases or the presence of comorbidities. The test has been validated in those over the age of years, children, patients with renal insufficiency or renal transplantation, hemophiliacs, patients with chronic inflammatory disease, and the general population. The tests are not applicable in 2% of cases. These cases can be detected by laboratory safety algorithms, and when detected they are indicated on the results sheet. Acute hepatitis, e.g., acute viral hepatitis A, B, C, D, E, drug-induced hepatitis extrahepatic cholestasis, e.g., pancreatic cancer, gallstones, severe hemolysis, e.g., some cardiac valves, Gilbert syndrome with high unconjugated hyperbilirubinemia, acute inflammatory syndrome. The blood test may be postponed. Interpretation. The FibroTest score, in this case 0.88, may indicate the presence of cirrhosis. The conversion of FibroTest score into stages according to the 3 most used histological classifications, METAVIR, Nodal and Ishak, for liver biopsies is
FibroTest Metavir Knodel Ishak 0,75
F4, F6. 0.73.74, F3 F4, F3 F4, F5. 0.59.72, F3, F3, F4. 0.49.58, F2, F1 F3, F3. 0.32.48, F1 F2, F1 F3, F2 F3. 0.28.31, F1, F1, F2. 0.22.27, F0 F1, F0 F1, F1. 0.00.21, F0, F0, F0. Comparison with liver biopsy. Liver biopsy is an imperfect tool. Due to sampling errors, biopsy size, 2 mm, and inter-observer variability, it is now agreed that biopsy is an imperfect gold standard. Citation required. Biopsy continues to present inconveniences. Percent of patients complain of pain. Up to % have been noted to have complications severe enough to require hospitalization. And a 0.01-0.3% rate of deaths has been reported. There is a mean discordance of % between FibroTest and biopsy. Half of these discordances are attributable to an error of the biopsy, often too small, and the other half to FibroTest. The inventors report that FibroTest has comparable diagnostic and prognostic value as a biopsy, while being non-invasive and easily repeatable.